was a joke for anybody live right now.
Yes, total joke.
That was a joke.
We are gonna go ahead and get going here. It is with great sadness today that we report 2 additional deaths due to COVID-19 in Macon County. Both were residents of Fairhaven's living facility in Decatur who passed away overnight. On behalf of the Crisis Communications team, we want to offer our heartfelt condolences to the families of those lost. This brings the total number of deaths reported in Macon County due to COVID-19 to 5. 1 would have been too many. We are working with the Illinois Department of Public Health to do everything possible to protect the residents and staff who work at Fairhavens. I spoke with Senator Andy Manar very early this morning regarding our concerns about the facility and asking for additional support from IDPH. He has been reaching out to state leaders on behalf of Decatur and Macon County. Our request is that all residents and staff be tested for COVID-19, residents and staff at Fairhavens. Many of those employees have already been tested. Those primarily went to Crossing Healthcare, and we do know of 6 additional staff members who were tested just yesterday, and we are awaiting results from the lab. We are also asking IDPH for help in training staff in infection control measures and proper protocol in donning and doffing PPE. There is a right way and a lot of very wrong ways to put on and take off PPE. And we do want you to keep this in mind, that this is very new for facilities such as Fairhaven. They are not working with infectious disease on a regular basis. So having to put on and take off personal protective equipment, it's new territory for them. And so it's not something that we want to point fingers at or blame. I did speak with a leader at IDPH this morning, and they will be helping to develop a training plan for staff members. IDPH has been in contact with our local health department from the very beginning of this outbreak, and I also want to really make sure everybody understands that the Macon County Health Department does not regulate or have jurisdiction over our long-term care facilities. That is an IDPH function. Brandy and her team have been working as much as they can to assist in any way possible, and they have been communicating daily with the Illinois Department of Public Health. With that, I'm going to turn it over to Brandy Binkley from the Macon County Health Department for her remarks. And I believe the county board chairman has stepped out so that we can maintain the right number of people in the room.
Good afternoon, everyone. Thank you for being here. We appreciate it. As Julie said, we are very sad to be announcing to you today that we have lost 2 more precious Macon County residents who had a diagnosis of COVID-19. They were both females in their 80s, and as Julie stated, both residents of Fairhavens. We would like to extend our condolences to the family and loved ones, the people that care about these residents. We ask that you all remember that these are not just numbers. Throughout our world, so many people have been lost in this COVID-19 situation. It's happening in our community, but all of these people have been people with loved ones that care about them very much, that may not have been able to be with them in their final moments of life, and that is all heartbreaking. I think we can all put ourselves in that situation and be very empathetic to what these families have already had to go through. And we ask you to give them as much privacy and respect as they grieve this situation as we possibly can. Also, as Julie highlighted, we have been in constant communication with Fairhavens and also with the Illinois Department of Public Health about this situation. Even before there was a confirmed case of COVID-19 in our entire community, as the health department, we've been proactive in communicating with the long-term care and congregate living facilities within our community to make sure that they were receiving the appropriate guidance from the Illinois Department of Public Health on how to prepare and also how to respond appropriately and try to prevent that spread of illness. With the reports that we've gotten regarding Fairhavens, the communication has even increased more, specifically with this facility, in reaching out to them directly and several members of their staff, and then also to some of our community partners who have connections with that facility, and then also with the Illinois Department of Public Health. We've been in very detailed conversations and finding ways to support Fairhavens, assist in their communications to the community, and do absolutely everything that we can as a supportive partner and also as the public health department, but again, without having that jurisdiction over them. So please, we ask the community to know and to at least be reassured to the point that we are very involved. And like Julie said, we have called on others to get more involved and take appropriate action as well. We want to take this as a chance to remind everyone that the stay-at-home shelter-in-place order is still in effect. We need everyone to follow that. I know it's such a difficult time right now for all of us to be so alone and split off from one another, and to be asked to continue to stay at home and be separated from these people that you love and you can't even give them a hug. I know it's heartbreaking. We're all going through that right now, but please continue to do that, because that is going to help save lives in our communities and throughout the world. And speaking of this difficult time we are all going through together but separately, there are a lot of mental health resources. So we ask the media, the public, business owners, churches, anybody that can, please help us get the word out about these mental health resources that are so excellent in our community and throughout the state that are being provided, because a lot of people are really struggling, and we need to make sure that they know whom they can call or text or reach out to get that support. We're all going through something extremely difficult beyond words, and we need to support one another, whether that's checking on someone, telling them they're doing a good job, telling them that you love them, giving them positive feedback, or just saying, are you okay? Here's a phone number that you can call. So if everyone can please help us check on others and get those mental health resources out there, we would be very grateful. So again, thank you for the support that the community has given and the actions that you have all taken to help prevent the spread of illness. And we're very sad to report this information, but we are very grateful for the strong partnerships in our community that are being extremely proactive in trying to address this situation across the board. So with that, I will hand it back to you.
Thank you, Brandy. We're also joined today by Dr. Venkat Menenganti. He is an infectious disease specialist in Decatur. He's been practicing for a number of years here and is an expert in the prevention and infection control. Dr. Menenganti.
Now we know the situation at the Fairhaven Christian Home, which is not ideal. And it's very important to know how sneaky this virus can be, and how majority of the individuals will be asymptomatic but still contributing to the spread of the virus in the community. It's more important now to realize that we have this problem, and we are doing our utmost efforts to contain the virus. We'll have the Illinois Department of Public Health help with the nursing home, deal with the infection control issues. And on that note, I will take any questions that you may have regarding infectious disease and infection control.
Sir, could you spell your name, please?
Venkat Menenganti, infectious disease specialist at Decatur Memorial Hospital.
Could you spell that? Could you spell it, please?
VENKATMINNAGANTI.
I do want to point out that this, like you said, you need to know important how sneaky this virus can be. Really, any kind of communal living situation. This could have been really any facility where there are people that live in a communal setting, correct?
It can happen in any communal setting. Could be a nursing home, could be a long-term facility, could be an assisted living center or retirement center. It just, the sneaky nature of the virus, not only it's sneaky, but it's also deadly, as you know. But the important thing is that sneaky nature of the virus that makes it spread to other populations.
What's the next step now that it's so widespread in this one facility? I mean, is it more containment and treatment rather than, I mean, if there's any that aren't?
Definitely containment and mitigation is the word now. So that's the job of the Illinois Department of Public Health at this point in time, to come and help with the nursing home to ramp up their infection control practices and see what the defects are, deficits are, and then go from there. Of course, we at the Macon County Health Department, and also as a infectious disease professional and being a staff of the Decatur Memorial Hospital, we'll be able to do our support in dealing with this crisis here.
once again, can you just drive home the point? We always hear people talk about the importance of wearing these masks, particularly if you're in close quarters with others. You know, how quickly can this infection jump from one person to another if someone just tilts their mask down for just a few moments around, you know, someone in an at-risk population?
Just to go back to the basics of infection, I mean, we believe this virus is transmitted by 8 droplets. So when somebody coughs or sneezes, I mean, it has tendency to propel at least 3 to 6 feet. I mean, and then anyone in the vicinity of that 6 feet distance would be able to get this infection. So all it takes is one cough and a sneeze. I mean, that's all it takes for the infection to come to the spread to the next individual.
Brandy, I think I have a question for you. Do you know the residents at Fairhavens who are showing symptoms, are they being separated from other residents, or how is that working out?
Yeah, so I can speak on what they have informed us that they have been doing. As far as them giving you, specifics, I would encourage you to reach out to them directly. But yes, measures have been taken to isolate the people that have been confirmed and also the people that have been symptomatic, per the reporting that they have provided to us and to IDPH.
Are all the residents under quarantine there?
So you mean as far as not letting unessential visitors in there?
Like
Yes.
letting
So for
people
quite some
out.
time, people that don't need to be in the building shouldn't have been coming in the building. So any non-essential visitors should not have been in there, and that's been in place for a while from the Illinois Department of Public Health. Now, you might have somebody that leaves the building for something that's absolutely required for something, let's say, such as dialysis, where they have to go for that, and then measures are taken for that as well, in that person leaving the building and also to where they are going. So all of that should be being done. All of that has been discussed between the facility and then also the health department, IDPH, and then the facility to which someone would be going for care that they are required to have.
The extra assistance that you're hoping IDPH can provide here, is that something that was there like a benchmark or something that needed to be hit for IDPH to really step in and ramp up these controls? Or was that something that maybe could have happened before, or even when this started in that facility?
So from a health department point of view, as soon as we have a confirmed case in a nursing home, or let's say if there's a suspected case, something like that, our health department has been communicating that information to IDPH throughout the duration of this process for all of the long-term care facilities that are providing reporting to us. So that information has been shared with IDPH and tracked in their capacity. So they've been informed throughout the process. And then once you get to the point of having a confirmed case of COVID-19, there's specific protocol. There are adjustments from what you do to prepare or try to prevent having a case in your facility. And then once there is a confirmed case, there are additional measures that have to be taken. So throughout this process of confirmed case, response, additional measures taken, IDPH has been communicated with. Now, as far as them getting more involved, that was something that we requested because of some of the information that we were getting from the facility and then also from the public. And we got them more involved. They've been even more heavily involved since that point.
And one of the things that you mentioned as far as additional help would be training as far as handling the virus and handling the extra equipment they would have to don to handle these patients. There have been posts on social media and people concerned that these nurses aren't wearing the proper PPE when dealing with the people in this facility. I mean, is that something that is because of this lack of training, or is that lack of equipment, or why is that the case?
I would have to let them speak on that, because I can say with confidence that they have received the protocol from the Illinois Department of Public Health, that they have been spoken with by our facility many times, and that they have also been spoken with regarding these measures by the Illinois Department of Public Health. So if that choice has been made internally, whether that is a facility choice, an employee choice specific to themselves. I know what you're referencing as far as the pictures on social media that came out last night. I became aware of that. I responded to that. I put that information through to IDPH to ensure they saw it. And I would have to let you ask them if that choice is not being made internally, why. Reports that we are receiving is that it is occurring. Obviously, those pictures tell a different story. And that is why I wanted that information to get to the regulatory agency that would be handling that, and that has been done and followed up on. We've been in a lot of conversations with them on an ongoing basis, and even a lot more since last night.
What is the protocol for reporting these deaths? I guess what sort of hoops are you guys jumping through? Because a lot of times we'll have the reports of these deaths leak out to us hours in advance. So what is your process for that?
Okay, so if there is a death in a long-term care facility or a hospital, that is to be reported to us, okay? Really, any kind of major change and then symptoms reporting in a place such as a long-term care facility is submitted to us daily, okay? So those deaths are to be reported to us per CD code. Now, one of the things I have spoken with someone about is the family is going to find that out first. And we always, respect next of kin notification and ensure that that is done before we would put anything out, to the media, out of respect for the family, of course. So we always ensure that that is completed once we find out before we put something out. Of course, I notify our partners, the crisis communications team and my internal team, to ensure that reporting has occurred in that way. We get drafts ready for things to go out and then put that out to all of you. But yes, there could be a very good chance that if someone in the family notifies the media before we put that out, you may know before we know. Another thing just to note is if someone passes away in their home, we are doing monitoring of people that are isolated in their homes every day. They are to take measures and then report those to our staff. That's part of that contact tracing process. So if someone did pass in the home, the expectation is we would find that out at least by the time we did our daily check-in. But again, that might be something that the media would find out from the family before we were told. Just because these things are happening, as you all know, very, very quickly. And you may within minutes find out from a family member before I hear from a hospital that someone has passed away. So I may not be able to confirm for you at that moment that someone has passed away because you might have found out, let's say, from a spouse before I did. Now that being said, I know the other evening there was a question from media about someone passing away, and we had not been notified about that yet. We immediately did some work between our team and I and my internal team of checking up on that. We did find out there had been a death that had not been reported to us yet, and we did provide clarification to that partner and said, hey, when there is a passing of someone, we need to be notified about that immediately. The expectation is immediately. I don't know what the intention was on their part, if they were going to let us know the next day. I can't tell you. They would have to answer that question for you, but we have clarified to them that that is to be reported immediately.
As far as the number of cases, right, sorry.
No, just to reiterate
Oh,
what
okay.
Randy was saying, and I did receive a call last night about, there had been word that there was another death. I hadn't been notified at all. We simply didn't know. And a lot of times, and as journalists, you know this, we respect the rights, of the next of kin. And just because one member of a family member may know, everybody else may not. So we give it a little time, because even though social media can get ahead of us and get ahead of official, the ethics of responsible journalism reporting, we are going to respect that. And, we're not going to lie to you, but we just may not be able to tell you. And as of last night, we simply did not know the situation we were in. And I'm sorry to interrupt you. Go ahead.
Oh, you're fine, yeah. The, as far as the number of cases and, capacity for treatment in Macon County, I mean, how have the facilities been handling that as far as PPE storages and things of that nature?
I can speak for Decatur Memorial Hospital, where we have enough of PPE for now. I don't know how long it's going to last. It all depends on how much surge we're going to have with these cases. We have a well-established COVID unit, which will take some of the surge if it were to happen. And we also, the hospital administration also ramping up other parts of the hospital where they can be made into a COVID unit with the necessary isolation precautions. That ought to be in place. We have a lot of patients with COVID infections.
Is that something that other places in the county facilities have? I mean, everybody at this other facility, I mean, they're not taking, if they're being quarantined there, they're not taking up spots in the hospital. Are other facilities well equipped across the county to handle the spread? I don't know.
When you talk about other facilities, what are you referring to?
As far as just the PPE storages that these facilities have, whether it be, you said you could speak on behalf of your hospital, but other treatment facilities, the county health department, just anything in that regard, any facility in that regard.
That'll be for Ms. Brinkley to address.
Yeah.
She may have more information than I do.
So in regard to capacity, as far as just being able to take care of patients that may have to come to facilities, whether it's for testing or for hospitalization, I can tell you our healthcare system has been incredibly proactive with this. As he stated, DMH also HSHS, RFQHCs. These entities have been very, very involved since we've been having conversations at the beginning before we had confirmed cases of COVID-19. So I can tell you, I can't speak on behalf of these facilities. I'll let them speak for themselves, but I can tell you, and I'm sure Julie would also support, that they've been very involved, very responsive, very prepared, and they are ready, you know, to respond as they need to. Also, you were mentioning about nursing home residents not taking up spots in hospitals. We also have to keep in mind, if a nursing home resident did need hospitalization, they could be taking a spot. So I just want to make sure to clarify that. As far as PPE goes, I think we all know, we've heard, you know, across the country, PPE is a concern. So one of the things that happens if a facility needs PPE, as far as like a long-term care facility, they would contact us. We have a person specifically assigned to immediately, you know, looking at our supply and being able to get them the resources that they need. So that would be specific to each agency or each facility, excuse me, but it would also depend on what their burn rate is and how quickly they're going through items. If you've got somewhere like Fairhavens and they've got confirmed cases, they're going to be going more quickly through items than another facility would. So part of what we do is manage resources, get them out, prioritize where they're needed the most and how quickly. Those requests from facilities come through us at the health department, and then we do forward those onto our local emergency management agency, which has also been extremely involved in this process since the beginning. They go through their processes to try to get us resources. We've also sent out a lot of requests for resources from just our community that have not yet been filled. And that's not specific to Macon County. This is happening everywhere. So another thing that's been done, there have been adjustments that have been made as far as how PPE can be used or conserved, that the life of those can be stretched a little bit, but also still keeping everybody safe. So I think everybody's really trying to think outside the box as appropriately at like your IDPH and CDC levels to try to make this PPE last for the people that need it, and then also to prevent that spread of illness as much as we possibly can.
Brandy, I want to throw a question out too, as far as tracking goes. Have you seen, are you concerned about some of the paths that tracking is taking? For instance, you've got, if this video or the story about the video is true, that obviously means that we've got staff that may have been exposed. You know, what's your concerns with that? Are you concerned that maybe we've got some issues?
I mean, those pictures definitely concern me. I did, as soon as I saw those, I did reach out in a couple of different ways to the original poster to try to get some additional information about when were these videos taken or when were these pictures taken so that I could get that to IDPH. I've not heard back from that person yet, but what I did go ahead and do was save those images, screenshot the posting and everything, and did get that submitted to IDPH very promptly last night so that they had that. You know, I can't verify if those were taken on the 13th. I can't verify if they were taken, you know, a month ago. I can't do that from outside the building, and as not being their regulatory agency, you know, I'm restricted on what I can do, but I sure can communicate. I sure can get the right people involved. I sure can ask them to check into it in the capacity that they have. Now, speaking to the staffing, yes, I know that they've taken measures or reported taking measures to us and to IDPH about isolating these staff and ensuring that PPE is being worn. So when I see a picture like that, of course, I was extremely concerned. And, you know, I'd like to thank again the people that reached out to us to ensure that we did see that so that we could respond in an appropriate way and help get that information to the right place. So thank you for that. Yes, if we have additional staff that are diagnosed, that have been in there, that could be potentially taking this home to their families, that grows the problem, and that is very concerning to me. I know we've been proactive. I know, you know, Crossing's done some testing, and I think the other healthcare entities in town, the call was made last week. Even though IDPH protocol does not automatically call for all staff to be tested, even all symptomatic staff to be tested immediately. In that situation, we spoke with IDPH and with Fairhavens, and we did get a change in directive to go ahead and have all symptomatic staff tested. So we do have several tests out right now. That being said, those people that have symptoms, the direction has been given more than once that they should not be working. Okay, and that is not just at Fairhavens, but any facilities. One of the things that we've talked about in this setting and in others, and certainly with Fairhavens and IDPH, is that long-term care facilities sometimes do share staff, and we did communicate the information to the long-term care facilities in town that there was diagnosed case of COVID-19. We did provide them the name of the long-term care facility because we wanted to make sure that they knew. Staff were directed when there was a confirmed case of COVID-19 at Fairhavens, the staff were told, don't go work in any other facilities. If you have symptoms, you do not come to work. And they are to be screened before they come in as well. And so they should not have been going to work anywhere else, and that's been going on for a little while. But we also assisted with that communication to the long-term care facility and then also to the Fairhaven staff directly from us. That's not a normal practice. It's usually the long-term care facility. But in order to assist Fairhavens in communicating as quickly, thoroughly, and frequently as possible, we have assigned staff to take that measure and assist with that communication. So we are hoping that yes, if there are staff at least who are symptomatic, that they have not been in that building. We've all also heard there can be people that are asymptomatic who could possibly be spreading virus. That can happen anywhere in our community. And Lindsay, to your question, yeah, this can happen in any congregate facility, and it can happen in more, and it most likely will happen in more, and we all hope that it will not. But it's important for us, to realize that and make sure that these facilities have the resources that they need to be able to respond and keep their residents and their staff as safe as possible and also informed. We've learned some lessons based on what's happened with Fairhavens locally, and we are sharing that information with other long-term care facilities and workplaces on stakeholder calls today, actually, and we have been on an ongoing basis. But to let them know, hey, it might be in your best interest to go ahead and communicate with the community immediately if you have a confirmed case, because this stuff does get out in social media, word does spread, and we do need to make sure that the community is informed and that family members, especially of these residents, aren't finding out in a way that they shouldn't be. They should be finding out from the facility, and we are pushing that, encouraging that, and really pushing proactive self-identification. Of course, that would be, up to the business, the long-term care facility, wherever that setting is, to decide if they want to self-identify. But based on what we've seen with Fairhavens, we are encouraging that to occur.
I do have a follow-up question to that about contact tracing. So I just want to clarify briefly.
Okay.
The contact tracing, normally you're doing that, but in the case of Fairhavens with their employees or anything, are you handling the contact tracing with that, or is that up to the nursing home?
No, so if you have residents that haven't moved from that building, the contact tracing is very limited.
But
maybe
more
if it was
for the
someone,
employees.
yes, for the employees we do. If it's a confirmed case, yes, we do.
Okay, so that is being done by the health department,
Yes.
the contact tracing.
Yes, it is.
Second, just housekeeping, do we have any update on any numbers of positive cases in Macon County today?
We do. There were not any additional confirmed positive cases today. And we will be putting a release out, the written release, a little early today, since we'll have everything ready and we didn't have additional ones for today. So we are still at the 43 total.
That change in directive from the Illinois Public Health Department as far as testing the employees, is that something that's specific to Fairhavens, or is that a change that maybe they've made with the increase in testing capability?
That was a change specifically for Fairhavens in this situation. Now, I can't speak on if they're going to start doing that, across the board. I know we have guidance that we follow and that healthcare providers follow for their staff in determining if they need to be tested. Now, the testing criteria does include healthcare workers, first responders that are symptomatic. So that is testing criteria that is available. So if there's a healthcare worker anywhere that's having symptoms, they can go get tested. Did you want to say something about that? I saw you walking over.
To answer the question, historically, if you go back to the Life Care Nursing Home in Washington State, when approximately about 90 people died from the nursing home, and there have been instructions at that point in time for the nursing home facilities to kind of do a universal screening at that point in time. It's not mandated, but it has been suggested.
This is more of a question for Brandy and the rest of the crisis team. How would you rate, I guess, the overall communication so far with Fairhaven since this outbreak started there?
You mean with the health department?
Yes. How has the communication, how clearly have they been communicating updates in this to you guys so you can inform the rest of us and inform their families as well?
I think that's kind of a few different answers. So, we did get a lot of complaints initially after the first diagnosis of COVID-19 in the long-term care facility. We were hearing from loved ones that have residents there in the facility. We also heard from some staff. Part of that protocol from IDPH is that the long-term care facility is to notify several different parties, including loved ones of residents as appropriate, that those notifications should be made, and that includes to staff. Because we were hearing from several people in the community that was not occurring, but we were told that it had occurred. I did do immediate follow-up work on that and ensure that it got done, and that would be reported to me. Now again, I've said you'll have to ask them specifically if and when they did that and why they chose to do what they did on it and on which day. But I can say that at this point it has been reported to me that those notifications have all been made. But you would have to ask Fairhaven specifically, to speak on their own behalf about that. But I have followed up on that very directly and very frequently to ensure it was done, especially when that choice was made to go ahead and test that entire wing that we came and spoke to you all about last weekend, and ensuring that all of those people have been notified that their loved one was being tested and what the results of those tests were. So I would encourage you to speak with them if you have follow-up questions about how they've done that specifically. But we certainly, have gotten more involved to ensure that that communication has occurred. And we also have taken very seriously the conversations that we as the health department have had with loved ones that have called us, with staff people that have called us, and have ensured that we've gotten that information to the right place. As I said, we're not their regulatory agency, but we certainly aren't trying to say that, not our problem. Absolutely not. We have been very responsive, as have our partners on the crisis communications team, in making sure that we are getting the right people involved and ensuring that these things are being done and that what is being reported to us is actually being done as it is. So I hope that the public can trust that that is occurring. I can tell you if I'm saying it, I'm an honest and upfront person, and I am telling you what's being reported to me by Fairhavens. But if you want to speak with them directly, I would encourage you to do that.
And we've been told by some of the concerned family members that the only line of communication to the families, to staff, to residents as a whole has just been through the county, that Fairhavens hasn't been notifying their own people as this outbreak has spread within its facility. Is that true, and if so, why?
I would have to say at this point, I can't say 100% if it's true. I will tell you what was reported to me. As of last week, I would say Tuesday or Wednesday, and then over the weekend when those tests were conducted, that I did say these calls need to be made. They need to be done by 10:30 a.m. The rest of the calls need done by the end of the day, and you need to report back to me. It was reported back to me that all of those were completed. If that was not done, I would have to encourage you to contact Fairhavens directly. But I think I've been proactive in directing that communication to occur when I heard that it had not been done.
And one other thing I'd like to add to, back maybe to Brandy's last comment, I can tell you that Decatur Memorial Hospital, HSHS St. Mary's, Tanya Andricks at Crossing, all reached out, in addition to Brandy's efforts, all reached out to Fairhavens to say, how can we help? What do you need? What kind of information can we give you? Do you need masks? What can we do for you? Do you want us to come on site and do testing? So there is great community support for everyone. And you also have to keep in mind, and I don't know if you have any experience with people in long-term care facilities, but a lot of times there are a lot of family members, and sometimes those family members don't talk to each other very well. And so where the primary person may have been notified, for example, I have a mom who's in long-term care here. I am her primary contact. My sisters and I are very close. I share everything with them. But it could be that we were estranged or not part of the same team, my sisters and I. And so if I didn't share with them, they might be angry that they were not reached out to individually. And generally speaking, and Brandy, you can correct me on this, there's generally one person that a home such as Fairhavens will reach out to. They can't hit everybody in the family. It's kind of like, I should be the link to the rest of the family. And so there is a possibility that the Fairhavens did everything they were supposed to do, but perhaps didn't reach everybody, and so somebody's mad. So I don't know that happened, but we're all learning from this, and this is new territory. And this Fairhavens has not been through this before. Our other homes haven't been either. But it was a heavy lift for them, and we're trying to help them as much as we can.
And as a representative from Fairhavens, at all been asked to join y'all here for these media conferences?
Well, as it is, we had to kick the county board chairman out into the hall. So to make way for journalists, we've had to be really selective. We had hoped to have Tanya Andricks here today, but we started counting people. Felt it was more important for Dr. Menenganti to be here as an infectious disease specialist. Brandy, who has had direct communication with both IDPH as well as Fairhavens, and I've been reaching out to our elected officials as well. So we're having to limit as much as we can. But in our original crisis communications team, we have a representative who reaches out to all of the long-term care facilities in the area and has that connection. So we're doing the best we can to get to be as inclusive, yet we have to limit the number of people that are in here.
Can we potentially expect a representative from that home to be here in the future at one of these?
You know,
as this
hopefully we
develops?
don't have any more bad news to bring you. That would be my hope. So hopefully we're not doing this anymore. That's my absolute hope. Probably, we could, but at the same time, then we're gonna have to eliminate somebody else. So, I'm not sure, I mean, that may be something that you reach out, and it may be, you know, it is a corporate facility, and they probably have their own protocol. Scott?
Yeah, I got a question going back on tracking again, maybe for Brandy.
Yep.
You know, one of the folks that passed away, I believe, was on dialysis. I believe was in for dialysis. My concern is with tracking, are you going back in and checking with folks at the hospitals and the places they've been, and are those folks being tested?
Those contacts are being made, yes, and I can tell you that if there's somebody, you know, without sharing anybody's personal information, of course, yes, anyone that would be going out of the building on dialysis that has been identified, and there are additional measures that have to be taken in transporting that person, and then also serving that person in a place such as a dialysis center, in order to isolate them, isolate staff at the dialysis center. So all of that communication has occurred as well, and IDPH has followed up on that in addition to the health department and whether or not those measures have been taken. And there's only, contact tracing is only done when there's a confirmed case. So if there is somebody that is symptomatic but not tested and told by their healthcare provider, just go home, you know, quarantine for 14 days, contact tracing does not occur with that person. It's just when there's a confirmed case of COVID-19 that we would conduct those contact tracing measures.
What's the protocol for like testing?
Oh, Dr. Mann.
Your question about dialysis patients from the nursing home. I did reach out to the dialysis physicians, the physicians who manage the dialysis centers, and in this particular case, they have instituted strict infection control measures at the dialysis center when they know a nursing home resident is coming to them. So they have all the PPE for the staff and for the doctors visiting the dialysis center.
All right, thank you, everybody. We appreciate you being here today, and we hope we're not doing this again anytime soon.